in the last 6 weeks or so, I've been shadowing, if you will, Dr. Smith and trying to learn as much as possible. You are correct that the training for this, in part, is multifaceted. I don't have a degree in public health, but many of the secretaries of health across the country don't have degrees in medicine, and are actually in other fields that come into this. So I do have training in a number of aspects of infectious disease. I was a researcher, a basic researcher, a clinical researcher. I have experience in vaccinology and vaccine trials. And I think that all of these things funnel into, in a way, preparing me, although this was not my goal, but preparing me for this role. I certainly have a lot to learn. I acknowledge that. I will make mistakes, and I will learn from those, and I will hope that others will, if you will, tutor me as I go forward.
Let's talk about the virus. What scares you most about coronavirus SARS-CoV-2?
I don't know that it scares me. I think that one of the things that I'm concerned about is its ability to spread very quickly in our society, and our society, for some reason, is not willing to take simple measures that will certainly mitigate the transmission. And that's what really scares me. The virus itself seems to be very stable. We're learning more about the immunology of the virus. We hope that we can develop a vaccine that will give us some degree of immunity to the virus. And those studies are coming along. So I think we're on the road to developing a way of dealing with the virus, but we're not ready to, and for reasons unknown to me, society's not ready to accept the responsibility of limiting the viral spread itself. We can do a lot to do that.
That's interesting, as you're a guy who's seems like has a specialty in vaccinations and in immunology. How much frustration do you have seeing that in so much of what we've come to expect from public health, immunizations help us, but in this case, we have to call on something different right now?
Yeah, let me just clarify one thing. I'm not an immunologist, and
okay,
I don't.
Sorry.
No. Those I don't want to take credit for something that I am not. I consider myself a virologist because of training and infectious disease expert and pediatrician. So I'm not so much frustrated by that fact. I mean, that we don't have a vaccine. I am frustrated by the fact that, I think the issue of masks has become politicized. It doesn't have to be. It's a public health issue. It's an issue that we do for each other as citizens of this country. We protect each other. In World War II, we all pulled together to get through that terrible crisis. The president has called this a war. And if you wish to use that analogy, it is. We can defeat this virus if you want to. If the virus is, we're anthropomorphizing the virus, but we have the measures at our hands length to take care of this. Wear the mask. It's not a political statement. It's a statement of public health, if you will, and it's a statement of caring for your fellow man.
How much of what you just said there have you managed to hone that message from years of confronting or consulting with people who are against vaccinations? How much can you carry over from that conversation?
I think there is a fair amount that can be carried over. The vaccine hesitant, they're vaccine hesitant for various reasons. In my practice, because I still am a practicing pediatric infectious disease specialist, I have families that have been reluctant to have their children immunized. I take the time to try to explain to them why it's important. And if they come and see me for several months, each visit is another chance to educate them as to why. Some I manage to convince that it is important. Others leave my practice when their child's problem is done, without having adopted or my view on vaccines, but at least they've listened to me and I've listened to them. And I try to dispel any myths or misconceptions about vaccine. The same thing applies here. The issue of the mask, and we all know that this mask does not protect me. it protects others. And that's the important part. And we need to move away. Well, I'm not saying that we are, but we need to remember that we are part of a society. It's not a just me aspect of life. We have to protect those around us.
When, just from a nuts and bolts thing, how much of a coincidence was it that on Dr. Smith's last day, the mask mandate came in? Has your philosophy on masks and mandating them, has it been different from what Dr. Smith's was?
No, I think that he, because I really didn't have very much to do with this, he and the governor dialogued about when this was necessary. It came to the point that the governor decided that this was an important issue. As the Secretary of Health, and I certainly view this as the interim Secretary of Health, my job is to advise the governor, to provide him with the best information possible. And then his decisions go forward. So I think that we all realize that masks are important. He has been using a mask for a long time and been advocating for a mask. And I think that, in my opinion, I think his directive is appropriate.
What's the governor like to work with?
I find him a very interesting individual, very intelligent, very quick on the uptake of issues that are medical or scientific. And I'm not saying that in a bad way. I mean, he's a lot of these things are very complex, and he's very quick. He's an avid reader. He understands things. We are just beginning to work together. I think we're starting to develop some rapport, right? I mean, as with any team, you have to sort of work together to get to know each other. And I think we're at that point. I'm hopeful that our relationship will get stronger and that he will trust me more as I go forward.
One of those things which falls into your specialty, and I've heard Dr. Gene Shelby here in Garland County, where I'm based, credited you with being the architect of the governor's education plan and Secretary Key's education plan. Those are his words. What's your philosophy in terms of the education plan right now?
Yeah, so let me dispel this. I am not the architect. Secretary Key is the architect of this, and I'm not taking credit for his work. I simply contributed my thoughts, and really it's Dr. Smith and Dr. Key and Mr. Key and the governor that came up with his plan. What do I think of his plan? I think his plan is appropriate at this moment. It coincides with what has been said by the national AAP, the American Academy of Pediatrics. It coincides with what has been said by the CDC. As I have said, and you've probably heard me say that nothing is static, unfortunately, with this virus, right? It's a disease, it's a pandemic in evolution. And what we have in place today may change in the future. And we have to be nimble. We have to be able to respond to that. And I'm hopeful that we will go forward and things will get better. But if things become worse, then we'll have to set that plan aside and move to another.
As a pediatric infectious disease specialist, how much has this virus thrown a lot of what we understand upside down? Kids aren't spreading it from what I'm seeing from the science. What's the state of the science today, and what's your reaction to the way this virus appears to be playing out with kids?
Well, my reaction is this is fascinating. I mean, as detached as a scientist, as a clinician, as an ID person, we're learning a lot from this virus. As you said, this has turned upside down our idea of who spreads virus. We for example, let's talk about common flu, right? The little ones are the vectors that spread it into our community. And this is not the case that we're seeing here. We know that now from more and more studies that in particular, I believe it's a Dutch study, shows that children under 10 do not spread this vaccine as well as children over 10. And the older you become, the better you have a chance of spreading this virus like an adult. And that's really upside down, as you said. So that's fascinating. The molecular and the immunologic aspects of this are also very interesting. That is, that when we look at patients that have had mild disease, for example, their antibodies, the antibodies that are in their blood, fall away very quickly. And that may translate into lack of long-term protection. So this is a very interesting virus, unfortunately, but it's teaching us a lot. And most of all, it's teaching us what we don't know.
In terms of the kids and in terms of the schools, I think a lot of people got confused in the last couple of days when at one point we say that we know it's going to spread. And then we say, but we know kids aren't spreading it. So I know it's difficult, and I know you keep talking about how this is not static, but can we try and get a fix today on what the science tells us, and how local do we need to get, district by district, school by school, or can a statewide guideline be put in place?
I think a statewide guideline can be put in place if we show that we are mitigating this virus, that we're bringing it under control. The more granular the information, the better, certainly. I mean, if we could get a widespread county, for example, data that is robust, we might be able to go that way. But right now, I think it may be possible to go with a statewide. It really depends also on testing, right? So in order to know really what the prevalence is, the amount of virus that's in the community, we need the community to test. And that's part of what we need to do as citizens, right? Is contribute to this database of knowledge of what the virus is like in our community. So the more information we have about the virus in our communities, the better we can plan, not just for schools, but things overall. Planning for, we may have a vaccine to be used in all people, and maybe we can decide where best to deploy that vaccine initially.
Speaking of testing, a quick little aside, Dr. Smith mentioned it a couple of times, and the concept of pool testing had a moment in Beijing. It's almost a month now. How close, without going too much into it, I've got all the, how pool testing works. I've got all those people to explain that. How close is Arkansas to being able to use pool testing as a tool? And it seems like something that could definitely help in a school environment where you need answers quickly, but you can't test 200 kids.
Right. So pool testing is approved by the FDA now. So the commercial laboratories can and will do this. I heard, and I haven't heard from the company itself, but I heard that Quest itself is beginning pool testing. That's a company that is a reference lab. We here at the Arkansas Department of Health have not adopted that technology or that methodology at this time, because we have at this time, and we'll have even greater capacity in the future, to do direct PCR testing. So for us, pool testing is not necessary at this time. It certainly can inform the decision if you have a shortage of reagents and you don't have the capacity to test large numbers over a long period of time. At this time, we have 2 high throughput thermocyclers. We are about to acquire 2 more. We will be expanding our footprint outside of the Arkansas Department of Health and placing at least one of these outside of the public health lab, because our space has been shrunken by the number of apparatus that we have. So I think we're in good shape. My personal opinion is that for a state of our size, we are one of the best public health labs around. We are well equipped and have a good supply chain to perform testing.
Just to clear up, I think I get what you say, but just to put a finer point on it. On the one hand, we say we need to test better, but we're not to the point, we have enough that we don't have to resort to pool testing. Is that kind of what you're saying?
That's correct. And I say that for the Arkansas Department of Health. Now, for commercial laboratories and private laboratories, that may be an option if they have now run out of reagents, or their supply chain has been impeded in some way. But for us here at the Arkansas Department of Health, we don't need that at this time.
Understood. You are Latino American. I don't want to put the name on it. How do you prefer to be identified?
You can call me Latino, Hispanic. I prefer Latino. In the 60s, I was Chicano. That's fine. The name has morphed over time. But I consider myself a Latino. I prefer the Latino instead of the Latinx, which I think my younger compatriots, associates prefer. Latino can be neuter, actually, in Spanish. It can be. It depends on how you use it. So it is fine with me. I call myself a Latino.
Very good. How eager are you to deliver a message to a community? Dr. Smith even said that was one of his regrets, was not being able to get a message to the Latino and Hispanic community in Northwest Arkansas, and particularly in those food industry plants. How eager are you to be able to deliver a message to that community?
I am very eager, and let me say that I think Dr. Smith is a bit hard on himself. From the day I started here, we had an effort to communicate a message to the Hispanic, Latino, Spanish-speaking population in the state. I had a weekly interview with a radio station here in Spanish and one in the Northwest. I also, since the beginning, have had interviews with television stations that are primarily Spanish-speaking. So while we can do better, and we need to do better, we've been doing that. I am eager to communicate with the Latino population and with all populations. We have to do a good job with communicating with the Marshallese. As you know, the CDC was here looking at the issue of the increased number of cases we had in the Northwest. They've listed us with very specific recommendations. One of them is exactly that for the Latino population. That is more communication directed to them. I'm hearing what the problems are, and I'm bringing them back to our communications area and having them address these. So,
how much of it's been fascinating to me as I've watched the state maps and the way that it seemed to be under control, but you looked and you would click on Sebastian County, you'd click on Fort Smith, and there were hardly any cases there. And it just seemed incredulous that the second largest city in the state could have a dozen cases. And then how much of that was not getting testing there or missing a community? Because now it's clear that it's all over the Northwest, and how much of that changed the direction of, or I don't want to say messaging, but just the way we understood the way we were tackling the virus in the state.
Yeah, I think that part of it is not so much the lack of availability of testing at that time. It was the public not getting tested, and that's why there was at the beginning of a very strong public messaging campaign to get tested. And we, the public health arm of, opened up our local public health units. As you know, every county in the state has a local health unit. We are using those local health units to test. And that's our way of contributing to increasing the numbers. We don't have, for example, requirements for testing. In other words, if you just want to come in and get a test done, we can get it done. You don't have to have a fever. You don't have to have a snotty nose. You don't have to be exposed to somebody. We want to know what the numbers are out there. And so I think that some of that is the lack of testing, that is the people taking the interest to get tested. I think it also shows what this virus is really like, right? It's silent. And if we don't look, we don't know where it is. And when we look, we find it. And if we're not on top of it, it will blossom like it did in the Northwest.
Starting to wrap up here. The governor said to me in one of my inartfully designed questions the other day that he's through making predictions about, he's giving up predicting where this is going to go. But unfortunately, that's your job. So what are your predictions right looking at the trends right now, do you have any benchmarks or things that we can sort of lay down over the next couple of weeks?
Yeah, if I could predict, I probably would have I would have retired by now with sufficient money to predict the stock market. I don't think we can predict. I agree with the government. I'm not ready to give up on it, but I think that it's all going to depend on us the citizens, the citizenry. If we take it upon ourselves to engage in simple mitigation methods, and I'm going to go back to the mask. I hate to sound like a broken record. Go back to the mask, wear the mask, wash our hands, maintain physical distancing between each other. We can bring this under control. Okay. If we don't, then the models that are out there are going to come true, right? And they may become worse. So, our fate is in our hands, and if the citizenry of our state wants to, we can bring this under control. We can shrink the number of cases that are out there. It's just a matter of wearing a simple mask and washing our hands, social distancing.
Yes, and I love how that the mask becomes so focused on the mask. The wash hands and the social distancing part, we need to reinforce that as well. Just a couple of quick things. Just what do you do for hobbies?
Not much these days. So three things basically. I like to read. I like to play backgammon, which I do online, I like to help my wife in her garden. She has a garden here. One of the things about this state is that there are large communal gardens available, and it offers the opportunity to have to grow wonderful things out here. So I'm sort of the work for her. She directs me, but to me it's wonderful to be outside. And it's wonderful not to be thinking. My job is usually to pull weeds, and it's fine. Just give me a row, tell me to pull the weeds, and I'm not thinking about anything other than pulling the weeds.
Very good. And I'll ask you one more personal question, which if you don't want to answer, I completely understand. But I ask it mainly because your replacement is also a priest now, or the man you're replacing is also a priest. Are you a religious man?
I do believe in God. I am religious. I would never compare myself to Dr. Father Smith. I don't know if the father is correct in the Anglican in the Anglican Church, but no, I do believe in God. My mother mostly was very instrumental in teaching me my religion. My success is in large part due to my Lord.
Completely appreciate your sharing that. Is there anything else you add that I haven't asked you about?
No, as I said, I think I have a lot to learn, and I want to serve. If I can say this, if you asked me today to apply to medical school and to write out why I wanted to be a doctor, I would write the same thing I wrote many years ago, which is I wanted to help people. It's very naive, very contrite, very, very, how can I say it? It's just said over and over again, but it really is why I wanted to be a physician. Public health is the greatest extension of that, because as a physician, we treat, a number of people, we influence their lives, but those persons that are involved in public health affect thousands, if not millions of individuals. And so this is a unique honor to be able to try to improve and protect the health of the citizenry of this state. I consider this the pinnacle of my career.